Hello everybody, and thank you for braving such horrible weather to come out today and listen to me speak. I'm a clinical psychologist by training, and for the last 4 years at least I've worked as a research psychologist, and I wanted to talk to you today about some of the work that I've been doing in fear of cancer recurrence as part of the National Breast Cancer Foundation postdoctoral fellowship. I also want to share with you some of the future directions for our research and tell you a little bit about how the National Breast Cancer Foundation has contributed to our research. So by way of background, when I first put forward the idea for this postdoc to the National Breast Cancer Foundation, we submitted a project titled The Sword of Damocles, an exploratory study of fear of cancer recurrence in young women with a history of breast cancer. And for those of you unfamiliar with the story of Damocles, it's a story from Greek legend about a courtier by the name of Damocles in the court of King Dionysius. And Damocles, wanting to flatter the king, said to him, "Oh, you are so wise and you have so many wonderful things in your life." And Dionysius, trying to, I think, teach Damocles a lesson, said to him, "Well, if you think it's so great, why don't we swap places for the day?" And gave him the opportunity to dine at his table. But what Damocles didn't know was that the king had arranged for a sword to be suspended above his head from a single horsehair, and in order to try and represent, I guess, some of the stresses and strains that being king involves. And very quickly Damocles realised being king wasn't all it's cracked up to be. And this story has been used many times over in the literature to try and illustrate both the constant fear that women who have experienced a diagnosis of breast cancer often live under, and also the difficulty this poses for them in enjoying the present moment and enjoying what life has to offer them. I don't know if it's possible to get a screen on here so I can actually see my talk, otherwise I just have to keep turning back. Otherwise, if people are comfortable with that, I'm happy to do that, but I'm sorry to not look at you. So why is researching fear of cancer recurrence important? Well, we know, as Alison mentioned, that survival rates from breast cancer are improving, and happily more women are surviving breast cancer. And so I think research these days is not just about curing or treating cancer, but also trying to understand the issues of cancer survivorship and help cancer survivors deal with some of the problems of cancer survivorship. We know from the literature that fear of cancer recurrence is the single greatest area of unmet need for help amongst cancer survivors. A study that I did in collaboration with some researchers from the New South Wales Cancer Council, which was based on registry data, showed us that up to 30% of cancer patients in New South Wales and Victoria report moderate to high levels of unmet need for help with fear of cancer recurrence. And in 2008, when I first started this project, the Breast Cancer Network of Australia, which is a large breast cancer consumer group, conducted a survey of over 800 of its members, asking them about ideas for priority areas in cancer research, and fear of cancer recurrence came up as the second most important area identified by that group for survivorship research. We know also from literature in general health anxiety and fear of cancer recurrence in other cancer populations like head and neck cancer patients that fear of cancer recurrence can be associated with things like increased cancer checking for cancer, and also sometimes avoidance of reminders of cancer. And if this is true for women with breast cancer, this may mean that there are potential health costs associated with not treating fear of cancer recurrence, both for the consumer but also for the health system. And prior to some of our preliminary studies in this area, this hasn't really been properly investigated. And although we know previously from the literature that young people are vulnerable to fear of cancer recurrence and breast cancer patients are a group who are vulnerable, no studies had previously examined fear of cancer recurrence in young women with a history of breast cancer. And I guess our ultimate aim in all of this research was to really try and develop some tools and resources and support services for women who have high levels of fear of cancer recurrence. When we started this work, there was really nothing available, and today there's still not very much available. I'll talk a little bit about our treatment work that we're currently working on. So our specific aims were to firstly identify how common fear of cancer recurrence is in young women with a history of early breast cancer, identify the impact that fear of cancer recurrence has on health service usage amongst these women and also their behaviour in follow-up care, and to try and understand some of the impacts of fear of cancer recurrence on the lives of young women. And we wanted to explore some of the psychological, medical and social factors that were associated with high levels of fear of cancer. And really, as I mentioned before, our ultimate goal was to try and gather information and gain a better understanding of fear of cancer recurrence to help us develop a new treatment program for this common problem. So participants in our early studies were 218 early breast cancer survivors who were at least 1 year post-diagnosis, who had no history of cancer recurrence and who were aged 18 to 45 years at time of diagnosis. On average, women in our study were aged 39 years at the time of their diagnosis, and on average they were 4 years and 2 months post-diagnosis when they participated in our study. And we recruited these women through 7 metropolitan hospitals and 2 breast cancer consumer groups. This slide just is a bit of a snapshot of our methods. So we invited 720 women to be in the study by either letter or email. 254 women responded to our initial invitations. Of those, 236 were recruited and 218 went on to complete a web-based questionnaire. We wanted to also try and gain a more in-depth qualitative understanding of the experience of fear of cancer recurrence, so did follow-up telephone interviews with a subset of 20 of the women in our questionnaire study. And our questionnaire included things like, obviously we looked at fear of cancer recurrence, things like health service use, their cancer surveillance practices, a range of psychological questionnaires, medical details and their social characteristics. And what were some of our key findings? Well, we have demonstrated, as we expected, that fear of cancer recurrence is a common problem in young women with breast cancer, and that young women with breast cancer are a group who are particularly vulnerable. We found that 70% of young breast cancer survivors in our sample had clinical levels of fear of cancer recurrence, or levels, what that means, I guess, in lay language, is levels that are high enough to cause them significant anxiety. We also know that it impacts on people's lives. Of the women who had clinical levels of fear of cancer recurrence, about a quarter said that it impacted on their mood and ability to make plans for the future on a day-to-day basis. We found also that fear of cancer recurrence was associated with significantly more breast self-examination, use of other forms of cancer self-examination, and use of support services like support groups, complementary therapies, counselling and GP visits. But also somewhat concerningly, we found that high levels of fear of cancer recurrence were associated with significantly less frequent use of health professional delivered forms of surveillance like mammograms, ultrasounds, and the use of other formal cancer screening programs. And when we looked at psychological characteristics, we found that high levels of fear of cancer recurrence is associated with a particular style of thinking, in particular one that's characterised by a tendency to ruminate, a tendency to focus attention on threat-related information, unhelpful mental coping techniques such as cognitive avoidance, and what that means in layperson's language is really just trying not to think about things, or thought suppression, which is really trying to push thoughts out of your mind, and a style of thinking that emphasises the negative effect and importance of worry. Somewhat unsurprisingly, we found it was also associated with generalised anxiety, general health anxiety, high levels of depression and stress. And in our sample we found it was associated with less time since diagnosis, and unsurprisingly, as this is common across the fear of cancer recurrence literature, it was associated with younger age. But interestingly, not with stage of disease, although we only looked at the various stages within early breast cancer. Not associated with level of education, social support, a woman's past cancer-related experiences in friends or relatives, whether or not they had children, or their attitudes towards having children in the future. So I guess what does all of this mean for clinical practice? Well, we use these preliminary studies to try to, and we went on to develop a new theoretical model of fear of cancer recurrence, which we used then as the basis for a new psychological treatment program for fear of cancer recurrence. So I had the great privilege of working with a team of very experienced clinicians, psychologists and psychiatrists through the Psycho-Oncology Cooperative Research Group of Australia to work on this project and to develop a new manualised psychological treatment for fear of cancer recurrence. In 2010, I trained 8 psychologists and 1 psychiatrist in the delivery of this intervention. And in 2010-2011, in conjunction with POCOG, we conducted a pilot study of the intervention, which demonstrated significantly reduced fear of cancer recurrence and significantly improved quality of life in a small number of women who participated in that study, both immediately following treatment and at 2 months follow-up. And we used the results of this pilot study to apply for funding through the NHMRC to conduct a large-scale nationwide randomised controlled trial of this intervention. And I'm very happy to say that we received that funding through a funding consortium which also included the National Breast Cancer Foundation to conduct this nationwide trial, which is currently just getting underway. So in terms of our future work, we want to gain using the very rich interview data that we've collected, we want to now gain a better qualitative understanding of the impact of fear of cancer recurrence on young women's lives. Obviously, we want to study the effectiveness of our new treatment for fear of cancer recurrence. And we're working together with Dr. Kathy Mihailopoulos from Deakin University, who's a health economist, on doing a proper health economic impact study of fear of cancer recurrence as part of our Conquer Fear project. I'm also collaborating with some researchers from the University of Aarhus in Denmark to try and develop better ways of screening for fear of cancer recurrence in the clinic. And we've together developed a short 5-item measure of fear of cancer recurrence, which we'll be validating in a very large sample of women. We want to publish the development of our theoretical model and also obviously the results of our pilot study. I was asked to think about ways in which the National Breast Cancer Foundation has contributed to my research over the years. I mean, I should also preface this by saying that prior to a postdoc, some years back, I was on a National Breast Cancer Foundation PhD scholarship, so I think I've had a couple of opportunities to experience help from the National Breast Cancer Foundation. And I think in both of those schemes, what's really been wonderful from a researcher's point of view is that they give you sufficient time and funding to follow ideas through from very, I guess, conceptual preliminary studies to practical outcomes for consumers. So in this fear of cancer recurrence work, obviously a very practical outcome from a consumer perspective is the intervention program which we've developed. And if that proves to be effective, well, that's a treatment program that will be offered to women with breast cancer around Australia and potentially overseas as well. And in the PhD project that I did, which looked at the fertility and menopause-related information needs of young women with a diagnosis of breast cancer, I then went on to collaborate with another PhD student, Michelle Peet, on developing 2 very practical tools, the first being a decision aid for fertility decisions for young women undergoing treatment for breast cancer, and the second tool being an information booklet on the impact of early menopause in young women with breast cancer. So I think these schemes provide sufficient funding to really try and develop some concrete outcomes. The funding that I now have also gives me the time to apply for new funding to do other projects. So, for example, in 2009 I was successful in getting some funding from the New South Wales Psychologists Registration Board to start a study which looks at consumer psychologist and clinician views of sharing mental health information within the cancer care team. And I've also had the opportunity as part of this postdoc to collaborate with a number of very senior researchers both in Australia and overseas, and to present the results of our findings to both the national and international scientific community. And I think it's very important to do that, otherwise nobody ever finds out about what you do. And I've had an opportunity as part of the postdoc to be involved in the training of postgraduate students, and through working at the Centre for Medical Psychology and Evidence-Based Decision Making here at the School of Psychology, I'm very privileged to work with some very inspiring clinicians and researchers. I was also asked to talk to you a little bit about what inspires me to work in breast cancer, and I've sort of put together a little photo montage of some of the things that I think have contributed to my interest in working in breast cancer. In 1998, when I first started working in this area, my mother was diagnosed with breast cancer, and I'm very happy to say she's still alive and well, and that's a photo of her celebrating her 75th birthday. And I think, you know, I already had an interest in this area, but there's nothing like a family experience of it to really hone that interest. The other photo also shows, I guess, having a foot in both camps, and what I mean by that is, as a clinical psychologist and a researcher, I've had the opportunity to work with people with breast cancer and also work on research projects, and I think those two things really inform one another. And I guess related to that idea is this photo of the hands, and what that's supposed to represent is a support group. And in 2000, when I first graduated as a clinical psychologist, I had the great privilege of being involved in establishing the one of the first young women's breast cancer support groups in Australia. And it was really some of the, I guess, issues and themes that were discussed in that group which became themes for the research that I've conducted in the subsequent 10 years. And the field of women is really just to represent the countless other women who I've met, both through my clinical work and also through my research, who have had breast cancer and told me their stories. And I think it's these stories that really inspire us and give us ideas as researchers of what needs doing next. So firstly, I just want to also say thank you to the National Breast Cancer Foundation for the postdoc. But research doesn't occur in a bubble, and there's a lot of people who have been contributing to the work that I've done over the past 4 years. I want to particularly mention Professor Phyllis Buto, who's my supervisor and mentor and who's here with us today, and also very proud to say she is the recently awarded New South Wales Premier's Cancer Researcher of the Year. Also, thank you to the Psycho-Oncology Cooperative Research Group of Australia, who have really gotten behind our Conquer Fear program, and my colleagues at CENPED. There's too many of them to mention individually, but a lot of people have contributed to our research on fear of cancer recurrence. So thank you for your time.